Before we start this awesome episode, we got to give a shout out to our friends and sponsors at Pet Greens.
Yes, this is like our cat's 5-star salad bar.
Right. They nibble on their organic cat grass like it's fancy hors d'oeuvres before every meal.
Yeah, and honestly, it's really an important part of their routine as well. It helps with their digestion, and it even helps with those hair balls.
Yeah, it does. And it's totally organic. No pesticides, herbicides, or any of that junk.
Nope, just super healthy greens that bring the outside in and help our indoor cats thrive inside.
You can find Pet Greens on Amazon, Chewy, Petco, PetSmart, PSP, and for our Canadian listeners at Pet Value too.
Okay, so now let's get to the podcast.
With wine. Always with wine. I'm Jay.
I'm Adrian.
And together we are the
Two Crazy Cat Ladies.
I'm going to cut you.
I think I just peed.
Buckle up.
We're back in the closet.
Welcome back to another episode of Back in the Closet with the Two Crazy Cat Ladies. Guys, this is episode two of the 4-part series that we're having with Dr. Randy, the pet vet, about cats, C.A.T.S. Last month, we spoke about C, which stands for complete nutrition and microbiome. That was like the biggest hit of 2026. Actually.
It was illuminating.
It was.
Even
I mean,
for people that
2025
already thought that they knew what that was.
Right. Absolutely,
sir.
absolutely crazy. And today we're talking about A, which is activity. And I personally am very, very excited for this episode because, you know, so many people just think cats are aloof and, you know, they prefer cats. Some people prefer cats just because they don't move that much. And I know you're here to debunk that myth. So Dr. Randy, thank you so much for joining us again.
Thank you so much.
Well, thank you. And I think you asked me to just do a quick introduction again.
Yes,
For all of our cat parents and guardians that don't know me, I'm Dr. Randy. I have a veterinary practice in Tucson, Arizona with my lovely wife, who is my boss. I say a lot of yes dears because that gets me through all the problems that I could possibly have. But I started in the world of veterinary medicine 43 years ago as a very, very well-trained Western medicine person. And I don't say that lightly because I went to the University of Pennsylvania. I stayed and did an internship, which is a rotating medicine and surgery deal. And then I went to New York City to the Animal Medical Center, the largest veterinary hospital in the world. You can't not see cases, which I'm a very visual learner. It was fabulous. But I noticed in my practice when I started that I was putting out fires all the time, but I was not getting to a place of wellness and health span. Met Dr. Andrew Weil here in Tucson, very famous integrative MD, set me on a path that has led me to this point. And the joy of this is I get to work with these two lovely ladies. We had an incredible night at C.A.T.S, and I hope that we can do it again. A little disappointed that I heard that we may not be seeing each other this year on tour, but I'm going to come to Vegas or you got to come to Tucson. So we'll figure that out. So
yes, we will.
Today is a really important day because we're talking about activity. And just like you said, many of our cats are just accepted as, very sedentary beings. We're not really thinking about what they need to be doing or not be doing, but it couldn't be further from the truth. What I've noticed in my practice is we're seeing so much cat obesity. And we're also seeing a ton of cat osteoarthritis or arthritis that goes undiagnosed. Because as you know, cats don't show pain. So if they show pain in the wild, they get eaten. So they tend to hide it from their moms and dads. And we picked this up on physical exam. So I really love talking about activity because I find it so important. And it's certainly related to the C because the diet is so critical and the biome is so critical. But let's specifically talk tonight about activity and, what can we do? What does it look like? What kind of things might we want to, and put into our program for them for 2026?
I think this is awesome because we're kind of in that same boat along with so many people in our community where it's like you have your job, you've got your housework, you've got all this stuff, and then you get sweet little snuggles. And it's like, so what are they doing for the 12 hours a day that 14, 16 hours a day that we're occupied doing other stuff. I love that you talk about activity as being non-negotiable for indoor cats. What do you mean by that? And like try to relate it a little bit to those of us that do have like long days and are so excited to come see our little love bugs, but they're making biscuits. That doesn't really count as activity.
No, the reason why I say it's non-negotiable is because we've got to get them definitely moving. And, you know, as you know, and I know, it's so hard sometimes when we've had a long day and we're tired. We just want to sit and snuggle. Nothing wrong with that. Obviously, that's great. But it is something that I actually talk about as a thing to do for our cats in 2026, to schedule 10 or 15 minutes of play. It's so easy to do. I mean, whether you decide it's an aluminum ball rolled up, a bottle cap, a catnip toy, a wand, do something, laser pointer, I don't care, but do something with your cat, you know, because getting them moving, you know, really makes a huge difference. One, they're a lot more calmer and serene when you're home with them at this point. And two, it's so good for their nervous system, their muscles, all their circulatory system, everything to be moving, just like it is for us. I mean, if I sat on the sofa and ate McDonald's every day and drank beer and watched football, I wouldn't look like this.
Right.
And, and I know you guys know this, but it's hard doing this, so we should be doing that for our cats and things like, I talk about like creating a new vertical space for them. Cats like to think in 3D, so a new cat tree or shelves on the wall where they can climb up. Or I love a window with a bird feeder outside, because this is my most fun moment, watching our cat patients in their exam room at our cat only practice called Feline Focus. They're staring at the birds the whole time. They could care less what I do,
Right.
I could be poking and prodding them. They don't care, so that kind of stuff is just so important. And I know it's a little bit over the top, but some people even schedule that 10 or 15 minutes on their calendar.
Yeah.
It's not a terrible thing to think about. Right. It's not a terrible thing to think about, but something we easily can do.
Yeah.
I want to come back real quick, because you said like you could be sitting on the couch drinking your beer, and for us we look at it as hard. And I look at it as with our cats, they crave engagement.
Yeah.
They literally, we can tell one of our cats at Zorro, when he's bored, he's very emotional about it.
And there's 4 other cats in the home besides him, right? But instead of going to the other cats, and every once in a while he will, but instead of going to the other cats and like trying to like rough around or something like that, play with them, he comes to us and he just like,
he's just like, come on.
Yeah. And you say something like, did you want to play?
He's like, are you talking about me?
Yeah.
Yes, we
And
are.
I love it.
Did you want to play? And he'll just start running like, okay, yeah, right?
Yes.
Like, and we don't necessarily know exactly what he wants every time, but he just wants attention and he wants us to move with him, and he wants to be active, right? He's actually probably the cat that we need to be putting on a leash and taking outside, because
which I love. I mean, people think that's an impossibility, but we all know that can be done pretty easily, desensitizing them to a little bit of a harness and slight ribbon on that, and then move up to a leash situation. Oh God, I love that. I mean, if you have the environment where that can happen, that's great. We are so cautious about our outdoor cats because here, and probably like Vegas, there's so many predators. And so, I want to really make sure that we have control in that situation and not just letting them outside or whatever, which some people will tend to do. So anyway, I think that this idea of natural feline movement and getting them into that is so critical. And we talked about this osteoarthritis thing, but just getting those joints moving, not just the food, not just the supplements, which I can advocate for all of that, but getting them moving, so great.
Yeah, it's like we always call it like the cheapest form of de-stressing and increasing longevity, really. Like it doesn't cost health span, right?
Yeah.
Like it doesn't cost anything to get our cats moving. And I get the outside thing, right? Like, I mean, some people do live in an environment where their cats can go safely outside, and
Sure.
it's, they don't have all the predators, or they don't live in a place where there's a lot of cars and things like that. They can, or they're at least safer outside than they would be here. But when we trap them in our four walls, right? And I don't mean trap, but we're trying to help them, right?
Sure.
We have to understand that, just like with food, outside in the wild, they would not be bored. They would not be sleeping somewhere. They would be moving around, hunting every little bug and bird, and they would be active on their own. But in our home, we have to do whatever we can in whatever way we can to get them moving, so that those joints don't break down early, and that they don't get obese, because just like with us, if we don't exercise, we get obese.
Yeah, I think real quick, I want to ask a professional opinion on this. I think a lot of times as cat parents think of activity as enrichment, like it's the bonus, it's the cherry on top to living in a safe environment, getting fed every day, having a clean litter box, like all of that. I want to talk about the health benefits. I want to talk about the difference that you see between mobility and digestion, the difference that you see between mobility and disease. Like, I think that this shouldn't just be looked at as like enrichment is awesome and it's stimulating and it's exciting and it's great, but there is that health aspect that I think that we're not necessarily prioritizing as much as we need to be.
Oh,
So,
absolutely. No, that's such a great point, because it is part of the health, the wellness, the health span, as you mentioned, of our cats. And again, we can talk all about the great foods and the supplements, the omegas and the joint supplements and all the other things, but getting them moving blood flow, moving lymphatics, using their muscles in different ways, like we talked about, like the vertical situation. Or, I love people that even, make feeding time like hunting time, where there's little cat treats around the house where they have to hunt for them. They move, they can do that even without us, which is so nice. So I just love that idea, because I think they go hand in hand. And in my world, I see much healthier cats that have that incorporated into their lifestyle. Of course, I'm in a little different situation where a lot of my pet parents and guardians are older, and they're home a lot more, and they can do a lot of this, where all of us are working stiffs, and we have to come home and we're tired, and it's a little harder. So it does take a little bit more, but it's well worth it, because that ounce of prevention is so much more than a pound of cure in that world.
Yeah, that's so true. And we've said, because our cats specifically, and all of the cats that we've had, really love that wand toy, and specifically the bird. I don't know if you've heard of that, but it's like it's a long. I mean, any wand toy does.
A very long, low profile wand, and a very low profile string, and with a very, with like feathers. Natural feathers as the lure, or you can use a little wiggle worm on the end if your cat prefers, kind of. All of our cats have always found that like it's their favorite thing in the world.
Yeah, and we also have many followers and customers that are maybe disabled or older, and they can't go for a walk with their cat, or they don't even in wheelchairs, right? And we always tell them, like, get one of these wand toys, because you can still get your cat moving while you're sitting still, right? And you can still work them so that they get the activity that they need, even if you're unable to move as much as you'd like to move.
And that's why I love talking to you guys, because what Two Crazy Cat Ladies give us is just the bird situation. I'm not always up on these toys and stuff like that. You're in that world where a lot of times you get a little more exposure than I do, but that's fabulous. There was a lady at C.A.T.S that made little cat balls, and she puts just a drop of the higher end kibble in them, and they bat them around and the kibble drops out, but that keeps them really busy. That's wonderful. So that's something that you don't even actively have to do.
No, and you can make those with a toilet paper roll and tape and scissors. Like those are fun. We've done those before too. And you can use treats like your cat's favorite treat, whatever it is. It doesn't have to be kibble. Freeze dried. We use their little freeze dried treats and put it in there, and they get really excited about batting it around and trying to get it out. So yeah, that's another great way to.
Can you speak to all of us briefly? Because when we saw you speak at Seattle, Jay and I stood there absolutely enamored.
We were like pushing our chins up.
We were stop. No, very seriously. It's rare to find a veterinarian in practice that is so invested in cats.
Especially a male veterinarian.
Especially a male veterinarian. Yes, that's
well,
true.
As I told you, I'm very in touch with my feminine side, so that's a real good thing.
Well,
yeah, you nailed it. But you see from a place of, you're in practice. You see these things. I love that you mentioned in your intro too, that you came out of vet school, no easy feat even to get into it, but went through very accelerated, advanced academic experience, came out a very well-trained Western medicine veterinarian. When we saw you at Seattle, it was just amazing to see someone so invested in cats. I guess what I'm asking is, you have this understanding of cats, not just as these beautiful little beings that have certain biological needs, like you see them, as these understimulated predators. These are, we call them house cats, but these are, I saw an article that said, perhaps the most biologically perfect being that has ever been created. Our house cats are both predators and prey, which can kind of tweak that behavioral element a bit.
And what makes them so stoic that they don't tell us that they're in pain.
Right. But what we think about as playtime, I do think we need to level up and look at it as being able to exercise those predatory instincts. You talk about it as an understimulated predator. Can you kind of, for anyone that's like, predator, my cat's not a predator, can you kind of, I guess, just kind of expound a bit on that as far as why this matters, not just so much for their bones, their joints, their digestion, but for their mental and emotional health as well, being the species they are.
Oh, and then I do want to go into digestion, but okay.
Yeah, and that's why I think all the different categories of toys are so important. Whether you talk about an interactive puzzle and treat, or a chase and hunt toy, or an electronic motion toy, this kicks in that predator instinct that they can use, and they know what's going on. We don't even know that we're doing that half the time, with them. So I love that idea. Given the opportunity, my cat would love to get outside and grab a bird. We don't let it happen because, one, we love our birds, and two, it's dangerous out here. But scratching and climbing enrichment is really cool. So I think all of that kind of kicks in that predatory aspect of their body without us even knowing it. And it does really make a difference. You're right. Did that answer that?
Yeah, it does. I mean, I remember back to the first time that I thought about it in that way of exercising their feline instincts instead of playtime, which seems so negotiable. I mean, who has time for playtime, right? In the real world. I think it was Dr. Marcy Koski that said, basically, playtime is exercising that prey sequence. It's engaged playtime is really giving them the opportunity and watching the psychological effect it has on cats as far as just mental sharpness, confidence, all of that. It was really illuminating.
Yeah.
Because it's one of those things where you're like, oh, that's cute. But you're literally giving your indoor cat the opportunity to have more fullness of self.
Absolutely. Yeah. Absolutely.
Yeah.
And I think it creates a much healthier friend for us. And I think that it does intervene on, there's got to be some level of boredom going on, and we if we can, help that out with these guys, which we're talking about, then we're definitely above the curve. And, it just it's a longevity treat. I mean, it really is. It's as good as some of the things that we talk about doing for them for longevity. I think that's why I said it's non-negotiable. I mean, it just it just has to be.
Yeah.
And I'm listening to myself because I gotta make a mental note that tonight I'm leaving here. I'm going to see our local U of A basketball team play. I won't get home till 10:30 at night. Fortunately, my two kids are there and they're playing with our cats, so, I do have a step in that will help me at least a little bit there.
Yeah. It can be hard for some of us.
I love the honesty though, because
yeah.
it is, I think that this aspect of activity of being
we say it's the
intentional about
hardest part.
it's the hardest part for us, which is why I say, let's schedule it.
The feeding hasn't been hard, like especially with this powder, right? Like scooping the litter, getting taking the toxins out of the home, like the cleaners, the chemicals, and the sprays and the plugins and all that. Like that was like, okay, well, let's do it, right? Like, and then it's done, and you're done. But the constant make sure that you have time or make time, for many of us have to make time to play with your cats. That has for years, and we're very honest about that with our following. It's like it is the hardest part is remembering, or for us, it has to be a scheduling thing in order to prioritize getting our cats moving. Now, luckily, our cats are still young and they do still play, and we do have all of their cat walls that like there's lots
vertical
of stuff
space, and a catio,
a catio, and the bird feeders and all the things.
That actually replaces
nothing satisfies them
engaged play
in comparison to actually playing with us, like being with us and moving with us, right? Like, because that's what they really want. Yeah.
In practice. Go ahead.
Oh, I was going to go back to the board cat for just a second, because Dr. Marcy Koski, who is a feline behaviorist, she told us that a board cat is a stress cat. And I kind of want to get into the health world here, right? So talking about board cats or stress cats, even though they seem like, oh no, my cat's super happy, they just sleep on the couch all day.
They're so snuggly.
No. Cats are meant to be moving. They are meant to be active. And like we said earlier, if they were outside, they would be doing it on their own. They wouldn't just be sleeping somewhere all the time. They would be moving as much as their bodies need to be moving. And we talked about obesity, and then that leads into diabetes and so many other things, but then also the stress, right? And how many diseases are created from stress.
Yes.
Especially in the feline world, right? From C.A.T.S to feline hyperesthesia, like so many things that are
so many idiopathic
issues are actually caused by stress.
Yeah.
At least every study that's tried to come down with a reason behind it, it all leads back to stress. And how much do you see in your practice, and how much do you hypothesize even that the lack of movement is creating more disease in our cats?
Well, I think I don't even have to hypothesize. I know. I mean, and when you talk about stress, if we look at it biologically, what's happening is the adrenal gland is being overstimulated in a flight and fight response. They may not be escaping that bigger cat or that dog or that coyote who's chasing them, but when they're stressed and they're not moving and whatnot, that gland just constantly gets stimulated, and you constantly release cortisol, which basically can cause hepatic lipidosis, the fatty liver syndromes, which can cause the weight gains, which can cause the diabetes, which certainly helps the joint situation, because they can only get worse. So yeah, it's pretty interesting. There's a lot of work being done right now by our friend Karen Becker and Peter Tobias in dogs about spaying and neutering. We're now learning that that there's a lot of what's called LH surge from the pituitary gland. LH, which is supposed to be producing eggs and sperm, doesn't do that in our neutered animals. And the question is, in our cats, because this is coming, how much of that is causing the problem? Because they're now finding that LH is very inflammatory. So if the pituitary keeps on kicking out LH, basically what's happening is it affects everything in their body. And we're now looking at all these new protocols for dogs in hormone therapy, because I think this is honestly something that we're going to see in our lifetime is going to come to fruition.
Yeah.
Oh,
Isn't
yeah,
that crazy?
it's really cutting edge.
I can't wait to see because everything that I've seen so far is basically cats are completely, I mean, cats are completely different from dogs and humans, right?
Well, they're trying to make it sound like they're exempt from this.
They're exempt from any kind of hormonal, and I don't buy it. And I'm glad you either. I don't buy it.
Well, but that does. I remember one time we did a cat tip on waiting as long as you can, especially with our male cats.
Yes.
To get them neutered until they're full grown, at least physically. And we were slaughtered in the comments.
Slaughtered, chastised. It was but we met with Dr. Judy Morgan and Dr. Lori Kozier and did an interview with them on I think it was Instagram, talking about this and talking about like, why is this and why do you guys recommend that? And both of them worked extensively in rescue and like 25 years of, just spaying and neutering, TNR, like that.
The youngest.
And then they said, what they see is, especially the male cats, but coming back, they all had so many, not all of them, but a huge percentage of them would come back and have some kind of urinary tract issue due to, this spay and neuter at, 2 pounds or 3 pounds.
Yeah. And there's a whole, you're absolutely right. I mean, the argument's going to be there. I'm not at all. I just did a big discussion with Stacy LeBaron on TNR. We're doing a podcast next week together. But there's this whole issue that we're not, we want to control this population. We need to take this under wing and do everything we can to help out the situation. But we also need to be thinking about the health and longevity of our pets. Yep. And I think what's going to happen, and again, this is way down the road, but I think you're going to see hormone sparing surgeries where things are getting done, but maybe the testicles aren't taken. Maybe the ovaries are not removed. Again, we're kind of getting off subject a little bit, but it does relate to what we're talking about. And it is something for the future that I think that, let our people listening to this know that it's been talked about once, Yeah,
at least, right?
Definitely.
We actually, one of our cats did have a ovary sparing spay. We were like, and the vet at that clinic was awesome. He was like, that is what I recommend, and that's what I would do as well. And we had just learned about this, and we were like, could we do this?
Yeah.
So that's like as far as we've experienced personally with it. And I do
love that it's evolving, and it kind of on point here, because I do think, your presentation that we saw in Seattle on cats, what an incredible summary of the ecosystem of a cat. I'm stealing that word from the amazing Rita Hogan. She does talk about all of our pets as individuals and holistically as their own ecosystem. And I think obviously everything touches something. So I don't think it's necessarily off topic. I do think that it's still, when you think about how changing the chemistry, hormones, all that impacts anatomy. I know that every cat is different. Every cat is an individual, but all cats have this need to exercise who they are.
Yeah.
And I feel like activity.
I like that you said exercise who they are.
Oh,
I love that.
Nice.
No pun intended.
You didn't even know that.
That was great.
It's so true, because I think it's fascinating to watch different cats different cats have different personalities around being a predator, right? What we call playtime. And I think that for those of us with multiple cats, and this is where I would really like your insight, for those of us with multiple cats that are looking to kind of schedule that playtime, 15 minutes a day with a cat, great. When you have 5 cats, we're 10. Talking about, we have people in our community that have 32 cats that they individually care for every day. How can we, what are some of your go-tos, especially with multi-cat households?
Well, that's a difficult question. I think that's wonderful to ask that. I think the go-to is it's got to be a conjoined effort. You're doing exercise with multiple cats at a time, and I think they get into it. I mean, I only have 2 right now at home. That's a low number for us, but they really love exercising together when we do those kind of things, whether it's the bird or whether it's a laser pointer. They'll get into it, especially if one's doing it, the other one really wants to jump in. I love that. So my hope is that you're in an ecosystem like you talked about, that they can do that together. And obviously, that 30 cat situation, you're getting 10 of them done at a time, or maybe all 30, who knows? I mean, that would be wonderful,
Well, I'm sure with 30 cats, I'm sure they're not all seniors. So they're probably they're interacting with each other already. So it's not going to be as much as maybe having 2 or 5 cats where, they play together, and that's always fun. But individually, they still need time.
Yeah.
What's your recommendation? You're in practice. It's one of the most beautiful things about, I love that you are real time taking care of it. It's
still
just,
doing it.
Yeah. Floppy Cat said Dr. Randy's a badass. Can he be
I love that.
Can he be replicated across the country, please?
Wouldn't that be awesome?
I
love it. Yeah. As long as I personally don't have to do that, if we could teleport or clone, that would be fine.
Right.
Yeah. I'm sure AI could do it at some point.
But
there you go.
In practice, you have cats of all different ages, sizes come in. What are some of your recommendations for, a sedentary cat that comes in as a senior to get them?
That's a great. So that's so important. So the first thing is a veterinary visit. The first thing is ascertaining what that cat has going on in its body. That could be a limitation, could be something that we may need to deal with, more slowly, or change what we look at instead of a vertical situation, keeping things horizontal. But I think the first step is always a really important veterinary visit that makes sure that we illuminate any osteoarthritis situations, any joint problems. One of my cats is Devon Rex, and he's got a bad hip. And you wouldn't know it. I mean, you look at this guy running around, and he hardly ever shows it. But on palpation, when I what we call abduct the hip, he'll go through the roof if I do it too hard, which I would never do. But I'm just saying, then it's a situation that we can talk about. Well, what can we do for that joint or that cat to help allow it to be more active? In other words, do we add omega-3s? We want to do that in their diet. Do we look at some of the joint supplements that might be really important to really help that situation? There's things like Adequan, which is a natural it's kind of a hydrocellulose that basically makes the cartilage imbibe water. And a lot of people don't know about Adequan, and I use a lot of it in my senior cats. It's an amazing product. It doesn't have a lot of problems with kidney and liver. And if you're interested, look it up. It's Adequan, Adequan. I've used it for years in cats.
Really?
You can give it underneath their skin. It doesn't have to just be given in the muscle. But what happens is you give it under the skin, and it actually goes to the joints that it needs to go to because they have higher blood flow. If you got an inflamed joint, you're going to have more blood flow. So what happens is it gets carried, and it causes the cartilage in that joint, whatever is left of it, hopefully, to imbibe water, get spongy. And by getting spongier, now you don't have that bone on bone as much. And I've seen some amazing results with something like that. So,
what do you know about UC2? Is it UC2?
Yeah, Ultra Collagen 2.
Yes.
So a very dear friend of mine, Christine Kolomenko, started a company called Jope, which is a dog product. The first dog product to be released. She's a French veterinarian. She lives in New York. And she started Ultra Collagen 2 with turmeric and omega-3. And it's called Jope, Jope. And it's an amazing dog product. I use it so much more than I would use glucosamine and chondroitin. There's a lot of research in dogs, and I don't know that I've seen this in cats yet, but that glucosamine and chondroitin isn't getting into the joints like we thought it was. It's getting eaten up by stomach acid. Where Ultra Collagen 2 doesn't, and actually is a much better protectant. And I can't imagine that she's going to be too far behind the 8 ball where we won't see a cat supplement coming out fairly soon.
Oh,
I'm
wow.
excited.
So awesome. I mean, I can't imagine why that wouldn't also be with turmeric and omega-3s. I don't know why that wouldn't already be a cat product that you could use.
Yeah.
Look at
Yeah.
this.
That-
Nancy just said Dr. Becker had me use Aticorn with my very senior kitty when I was her client.
oh, wow.
I don't know how I've never heard that word before.
I have never heard of it before. That is very, yeah.
You guys who are all knowing, I never thought I could pull anything over on you guys.
You
We're
have so much
apparently
information.
living under a rock.
Yeah.
But Nancy's right. I mean, it's a great product for a senior cat. It can be given like once a week. In dogs, often what we do is we start it twice a week, and then we back off to a 2-week injection. It's an injection. Yeah. But we also, a lot of our cat owners, you know, I don't want them running down to the practice every week to get an injection. So I teach them how to give it sub-Q shot, just like they would be giving insulin, you know?
Yeah.
And it can work really, really well. I love it. I love that product.
Okay,
Wow.
so
There's some warning. Sorry.
go ahead.
No, there is some warning with it on like severe kidney cats or severe liver cats. But honestly, I've even used it in those and I've never had a problem with it. I just love this product.
I feel like, I mean, also like for us, right? Like when say they're not severely arthritic yet, right? Like they're just starting to slow down. I feel like that is the point where sure, supplements, especially omega-3 fatty acids, you know, there's a lot of things that we can do, but I feel like that's the point where we really need to get them moving, right? Like because movement, like nothing replaces movement. You can give supplements and things like that, but the
Right.
movement itself is so important. I will say our oldest guy, when he was alive, he was 20 years old, and his name was Scotch. And he was so active. He used to be as a young broad. He was like a broad. That's not the right word.
A
As
young lad.
a young lad,
Yeah.
a young boy. He was indoor, outdoor, and he was just always just like the best cat. And when he turned 20, he really started to slow down. Like you could tell, like it was just, you know. And I was like, we were giving him all the supplements that we knew at that time. That would help his joints. But what I would do is he was food driven. So at feeding time, instead of, because he didn't want to play and jump and run or chase or anything like that at that point.
Sure.
So I would, instead of feeding him all of his food at once, I would take a spoonful of his food and I would put it on a little plate and I would put it down and he would eat it. And then I would, or I would put it all down. He would eat a few bites and I would pick it up and I would take a few steps and walk a little bit further and I would put it down and he would come and he would eat it again. And I literally walked him around the house every meal time because I felt like he really needed to move and I couldn't get him to move any other way.
Yeah. And you know, this is a great situation for what we call baby steps, you know. I can't remember the Bill Murray movie, but you know, little baby steps. And in a senior cat like that, by all means, you know, we don't want them, you know, jumping off of the sofa. We don't want them jumping down off of shelves and stuff like that. But getting that little motion again starts the blood flow, starts the lymphatics. You know, those are cats that often will do cold laser on or will do PEMF, pulse electric magnetic therapy. I know this sounds crazy, but we even have had cats in our underwater treadmill that will tolerate the water. I mean, it's not every cat that will do that, but it certainly can help. And so our rehab situation is not just for dogs. You know, we do a lot of cat rehab too. And those are guys that we can really help. But you know, like you said, it's great to get them earlier, obviously, because hopefully we don't get them to that point where we have to, you know, really be so careful about what we do.
Okay, so I think we kind of went down that senior cat rabbit hole. I think a lot of us, I know that we found ourselves in the situation. We welcomed a new family member that was 27 pounds at the time. Obviously, a big boy. We asked our veterinarian, which I'm curious about your opinion on this. So when people ask us like, well, how much should my cat weigh? I always say you should ask your vet what their healthy weight is and what their body condition score is.
Yep.
because I didn't even know what the body condition score, and with our Pooh Bear, you think most cats are around 10 or 12 pounds.
Right.
They said his healthy weight is 17.
Yeah, he's a big boy. He's big bone.
Yeah,
That
well,
body score index is so much more important than weight.
right.
So what I will tell people to do is go online and look for a body score index for your cat, because it'll show you 1 through 9 and where they should be. And we always do body scores on our soaps that we do on our cats that we see. And I do talk about the cat that I see that has a body score of 7 or 7.5 or 8 or whatever. What can we do for those animals to help? Well, obviously getting them moving is one thing. Obviously getting them off of the kibbles that we talked about is another. And working with, high quality protein foods, obviously with the supplements are great. I do think that we will see GLP-1s for cats. It's already being developed for the dog. There's a company right now that's producing what they call a longevity drug, which is a GLP-1. Honestly, that's all it is. And it's for the larger dog that's overweight, basically. We don't know the long-term effects of these things at this point, but there are ways around some of this, but you can do this without medication. Honestly, you really can, as long as there's not anything else systemically going on.
I love that you mentioned that, so I think, when we talk about activity with cats, like it's great. And I really do hope that people kind of look at this as not as playtime, but prioritize it as
health time,
as understimulating their little predators that live in their house. It will help their health span. I think that we do run into challenges when we get into the senior cats, which I'm glad that we kind of walk through. With our cats that are already overweight, sometimes I think it feels like they think the only thing they can do is caloric restrictions.
Sure.
Do you have you worked with a cat that's kind of a chunk that, what are some ideas that you have to kind of get that little one moving? Is it kind of like what Jay said about it's dinner time, let's move your food around, we're going to make you walk all over the house? Or do you have any ideas like for
I think so many things that we talked about would be pertinent in that world, but again, in starting very small. And people don't realize that when we talk about caloric restriction, we don't mean starving your cat. What we mean is getting them off of high caloric, poor diets where we're using the fresh whole food or the lightly cooked diet or the freeze dried or frozen raw diets. Because these are protein and veggies, and they get their carbs from the veggies. They don't need, cats are obligate carnivores. They don't need carbs, not in the way that we're used to doing it, So you're absolutely right. And then, slowly doing things. I mean, like Jay said, that moving that dish around is a great start. And then working into other play toys or whatever would be really, really wonderful. But I tell people the most important thing that we have to consider is slow. It's not, we don't want them to lose 5 pounds in a week. That's not healthy. That's where we do get into the hepatic lipidosis, the fatty liver syndromes and whatnot. So each one of them is an individual, but also I think checking blood work is a very important thing in this situation, because I have found cats that are hypothyroid, where their thyroid gland's not producing enough hormone, so their metabolism is off. So everything they eat, they're incorporating, or I have corrected their biome, and all of a sudden they're starting to lose weight because they're not getting into this leaky gut syndrome and absorbing stuff that they don't need. So it all interplays. Everything we've talked about really works together hand in hand.
So what for all of us, for those of us with cats that are 8 and under, still very active, those are senior cats, maybe cats that are already a little chunky, what one small activity do you think that we could all start incorporating? Like if we're going to put it on a schedule, what's your one suggestion for all of us that we could start?
Well, I don't know that I would have a one answer. That's such a great question, but I think so many things we talked about, it really is what the cat will love more than what I would suggest. So whether it's whether it's a catnip toy, whether it's moving a plate around, whether it's a laser pointer, whether it's a aluminum foil ball. I mean, we have so many options. I just kind of I leave it up to my cat a lot of times because I think they tell us, what they love, and then just do it, just doing it. I think so many times, Adrienne, this is falling on us and not on the cat. It's falling on us because we're not doing it, So if we just do it, and even if it's in small amounts, it'll make a big difference. It'll make a huge difference.
Yeah.
I agree.
I do have a comment. I've seen a couple of these comments that I thought I would react to. So Floppy Cats has asked about GLP-1 for cats. Will I be game for this? I want to see what the research shows us down the road. I'm not going to comment that I would be game or not game. Basically we have to see what that shows us. And also JR mentioned that he did have a cat that had an adverse reaction to Adequan. It does happen. I think JR is great for mentioning that. And Kim talks about working for a holistic vet, and they do underwater treadmill for cats. Of course, it can go very, very well, taking the right steps and taking it slowly. So I just wanted to comment on some of the comments we've been getting.
Oh, I love that. I love that so much. Yeah, it's just, I think the main takeaway is get your cat moving, right?
Yeah. And maybe that means
basic,
you get moving.
And
maybe that means that you do say, when I get home from work,
I'm going to spend
my day
10
is
minutes.
done, we're going to do 20 minutes. Or maybe it's in the morning, you get up 20 minutes earlier. I really do think that playtime, no one in this modern world has time for playtime unless they're super footballers at this point, right? For our cats, it's not playtime. It's part of their species specific needs.
Yeah. I also just want to throw out real quick, because when our Oliver Twist, when he hit his senior years, and he was the door dasher. He's the one that always wanted to go. Oh, excuse me. He's the one that always wanted to go outside. I'm sorry, babe. When he hit those senior years, and we didn't let him go outside because he was also like, I want to go explore the world. And
he was squirrely
and then and scary. But do think, when you have like a geriatric cat, one of the things that we did as he got into those geriatric years is we did let him go outside with us, and we would sit outside and we would watch him, but he was no longer going to jump the walls.
Right.
He was no longer going to
enriching.
But it was so enriching for him.
He would roll in the dirt.
He would walk, he would run, he would move, and we couldn't get him to move as much inside, but when we brought him outside, he would move a lot. And that's something that maybe we should think of if anyone listening that has a senior cat, that you still might be scared, we are, that they're going to be attacked or run away or whatever it is if you let them outside. If they're in those geriatric years, supervised time outside, not even necessarily on a leash. He really did not like the harness. He kind of fell over. We tried that, but supervised time outside is another great thing that is both mentally stimulating and physically stimulating for our kitties, for our senior geriatric kitties.
Yeah, and there's definitely something to be said, as we all know, because we live in this kind of environment. You guys in Vegas, me in Tucson, the sun and the air are so important, and I feel for my cats a lot of times that I don't think they get enough of that. And it's hard. I mean, I have clients here that create catios, and, they're outdoor enclosures so that the cat can be safe, but can be out there. And I think that does help too. But yes, absolutely. On the senior cat that, we know we're not going to lose because it's not going to jump the wall, like you said. Right. It's a great way to go. Obviously, outdoors is a great way to go.
Yeah. Real quick, a comment that I just saw come in. I know we got to wrap it up.
Sure.
And I want you to give us a teaser on our next episode with you. But
sure.
Susan is asking about PEA for joints, palmitoid ethanolamide. What are your thoughts on that?
I don't know enough about it. I think I saw that question, and I probably have to look at it more, quite honestly. It is something that I really don't know that much about. So me, I'm always very transparent about this. If I don't know, I'll look and I'll come back and tell us. But I don't know much.
I love
be
that so much. So,
continued.
so Dr. Judy Morgan is a huge advocate for PEA for both cats and dogs and people. But yeah, it's proven to really help as far as joints are concerned, as well as the nervous system and lots of things. We advocate for it for cystitis, for feline idiopathic cystitis, because there's so many studies on that. With PEA, but I believe there's probably also, I'm sure there's probably a ton of studies on joints too.
I'm going to have to look for sure. I would definitely take a look at that for sure.
I love Hubler's my lazy play tip. I think we can put this one in our pocket, right? Yeah. When I was busy, I tied a long string to my belt loops, and so when I was walking around, she would chase it. LOL.
See, it can be as simple as that, guys. Thank you, Hubler. Thank you so much for that.
Absolutely. What a great listener. That's a great suggestion. And that kind of stuff, it doesn't have to be complicated. It doesn't have to be an expensive thing. Yeah. This is great. That's a great way to go.
I love it.
Yep.
Amber
with your
cricket
cats moving.
I said walking in PEA did wonders for cricket post bilateral luxated patella surgery. Surgeries. I love that. Amber, also, we need to follow up with you because you won the VIP giveaway and we still need to know what product you won. Dr. Randy.
Yes, ma'am.
He called me man.
There you go.
Do you feel old?
No, I kind of
just respectful.
I just kind of like it. I know, yeah. I mean, I grew up in Michigan, but spent a lot of time in the South, so ma'am is a respectful thing. And so let's give a little teaser for our next episode coming up next month, because this, and it's perfect timing, right? February is Dental Health Awareness Month, and this is something that is very important for our cats. Can you give us a little sneak peek?
Absolutely. So in my cat's mnemonic, T is for teeth. And people say, like, well, why do you want to spend all this time talking about teeth? It's because in my world, and once we start looking at this, this is so critical. Because again, our cats have stomatitis. They have resorptive lesions. These are incredibly painful. They can be incredibly problematic. They're very inflammatory. And we need to talk about this because they're hiding this a lot of times. And again, I'm not trying to just strum the veterinarian's, guitar here, but, an exam sometimes is really important to find these, because I have clients that have no idea. And I open up the cat's mouth and here's this resorptive lesion. And all they have to do is take a very light Q-tip and touch it. And the cat just twitches. And I don't do that to hurt the animal. I do that to make people understand how bad this is, how your cat is just suffering with this and not letting you know. So we're going to talk about teeth because I think it's so critical, and the biome in the mouth and the biome in the bow and how that all affects it. But that's definitely coming up, and we'll have a whole segment on that and have fun with it, just like we've had fun on these first two.
Oh, I'm very excited because it is such an important subject when it comes to teeth. I will tell you just off the bat, and as more of a teaser, we didn't find out that there was any, we didn't even think about our cat's teeth whatsoever until one of them, we found a rotted tooth of one of our cats in our bed.
A canine tooth.
Canine
in the sheets.
In our sheets, in our bed. And it was like, we should do something about that.
And then you went around hunting to see who lost a tooth. If one of us humans lost a tooth like that, you know well before that tooth fell out, that's the right. Like, that's how stoic our cats are.
Yeah. So it's going to be
especially a canine tooth that's up in the maxillary sinus. And oh my God, that's got to be so painful. And it's the root of so much infection that, how does that happen? And we don't know it, because it does. I mean, I've seen it a lot of times. And, I'll go into an examination and I'm just kind of, looking at their mouth and I'm just touching it and it's already moving. And I'm, oh God, that's just that. It hurts. It really hurts.
Yeah.
It hurts me. It hurts the owner when they find out. Let's not let that happen. Let's talk about teeth next time.
Yes.
We'll do that.
Yeah. And that's why we all do what we do, right? Like we have learned most of the stuff the hard way. So
absolutely.
we're very excited to have you back on next month, which is National Dental Pet Health Awareness Month, or Dental Awareness Month. in
Nailed
February.
it.
Whatever. But we're very excited.
Yeah, and one of the things I just want to end with is, a lot of people say, well, how did you get to this point where you kind of know the things that you know and doing the things you do? I tell people because I made every mistake in the book. When you make mistakes and you learn from them, you'll never do them again, especially in my world when it can really affect an animal's health. And thank God none of them were so bad that I don't forget about it. But, that it really helps to learn from those things. And that's how we all learn, that we learn from these kinds of situations. And we're laying this out there for our people so that they can pass it on to others. So make sure you watch this. If you haven't watched it or you haven't watched the C, tell your friends about it. We're going to keep on posting these. So please join us.
Yes.
So I'm so grateful for you, especially from a place of veterinarian, which I think, you come from. Veterinarians are, that authority that really help us be better pet parents. You come from this very beautiful, understanding place. I love that you just kind of said that about all of us making mistakes, and and how helpful it can be in our journeys. That it's not necessarily a failure. It's really a step up. And you're so non-judgmental, and you're so helpful in helping us better understand our cats.
We love you, Dr. Randy. We love you so much.
I love you guys too. And Happy New Year. And for all your listeners, thank you for coming along with this journey. We're going to spread the word. We're going to get more of this out there for all of our cat people to understand.
Yes, absolutely.
Amen.
Absolutely. So we will see you guys again next month. We will see you, Dr. Randy, again next month to discuss. And thank you so much. And then again, take away, get your cat moving right now. Go play with your cat. Go play with your cat. We love you guys so much.
Happy New Year, everybody.
Happy New Year.
Thanks, guys.
Bye, guys.
All right, we'll see you soon.